Hi, I'm Ariel Rippey. I'm a student at Ball State Community College, and I'm in the respiratory care program. Today I will be discussing how advanced directives and palliative care are incorporated into respiratory care in the clinical setting. Advanced directives are very important for patients to determine their personal health care wishes. Patients are allowed to file paperwork in advance before any health care problems occur that will enable the patient to make conscious decisions about their care. Patients often choose to become a DNR, which means do not resuscitate, or DNI, which means do not intubate. This is very crucial to respiratory care and how a patient's care plan is established. DNR status means that the patient does not wish to be resuscitated in the event of a cardiac arrest. The healthcare team needs to be aware of any patient with a DNR status. This prevents resuscitation against the patient's wishes. The DNR status needs to be visible on the outside of the patient's chart to prevent any medical error. Many institutions even require that patients with a DNR status have a wristband. DNI status means that the patient has decided that in the event of respiratory failure, they do not wish to be intubated to receive mechanical ventilation. Here is how to file an advance directive. First, obtain a packet for your state-specific advance directive. This form will prompt you to choose a healthcare agent. A healthcare agent can speak for you anytime you are unable to make your own medical decisions, not only at the end of life. Secondly, fill out the paperwork that gives individual instructions regarding patient care. These forms will be accessed when the patient can no longer clearly speak for themselves. Next, the advance directive must be either signed or notarized, or signed and witnessed by two different people. The witnesses cannot be the healthcare agent, cannot be related in any way, or cannot be inheriting any of the patient's estate. The advance directive goes into effect when your designated physician determines that you are no longer able to understand the significant benefits, risks, and alternatives to proposed health care and to make and communicate a healthcare decision. Many things may not go as planned with advance directives. For example, the patient's chart may not be labeled DNR, DNI, or the patient's chart may not be available at the exact time of the emergency. In the event that this occurs, the healthcare agent has the ability to carry out the patient's wishes and discontinue prompt medical care. And then I have some information about advance directives. It just shows the percentage of people in the United States that have advance directives. 25% are home health patients, 65% are nursing home patients, and 85% are just discharged hospice patients. We got this information from gstatic.com. Now I will continue and discuss palliative care. Palliative care is a specialized medical care for people with serious illnesses. It focuses on providing patients with relief from symptoms, pain, and stress of a serious illness, whatever the diagnosis may be. The goal is to improve the quality of life for both the patient and the family. Palliative care focuses on symptoms such as pain, shortness of breath, fatigue, constipation, nausea, loss of appetite, difficulty sleeping, and depression. It also helps the patient gain the strength to carry on with life in the event of a serious illness. It improves the patient's ability to tolerate medical treatments, and it helps the patient have more control over their care by improving communication so that they can better understand their choices for treatment. Palliative care is performed by a specialized team of medical personnel to supply an extra layer of support. Advance directives are also a large part of palliative care to ensure that the patient's medical wishes are fulfilled. Palliative care growth in hospitals has been exponential. The number of teams has doubled over the last 6 years. To date, there are more than 1,500 hospitals with a palliative care team. In the respiratory field, palliative care involves making the patient's respiratory efforts as comfortable as possible during chronic illnesses and late stages of terminal diseases. Respiratory therapists can assist in palliative care by requesting morphine for pain control and ease of agonal respirations. By doing this, the patient's respirations won't be as labored and difficult. Positioning and suctioning the patient will help mobilize secretion and ease breathing in the late stages of a disease. Respiratory therapists also perform comfort weaning when mechanical ventilation is in the final stage of a terminal illness. In summary, approximately 90 million Americans are living with at least one chronic illness. Today, 7 out of 10 Americans die from chronic disease. These statistics support the critical importance of advanced directives and the high demand for palliative care in the modern healthcare world. Advanced directives and palliative care are crucial to provide patients with respect and individualized healthcare decisions when any medical issue occurs. All healthcare professionals should be aware of patients' requests and do their best to fulfill the patient's wishes. And here we also have another diagram. It's just of palliative care, and of people in palliative care, 57% died, 31% were other, 6% were discharged or transferred to other health care, and 6% were a statistical discharge. We obtained this information from aihw.gov. I hope this information was very informational